Member for New Westminster.
Thank you, Honourable Speaker. Last December, Fred Cosman from Princeton developed serious swelling and pain on his nose. It took 4 months before he was diagnosed with lymphoma. He still hasn't had a single treatment. After months of waiting, his face is swollen with cancerous lesions almost beyond recognition. My question is to the Minister of Health. Why has Fred been waiting so long for treatment?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, again, in the House, we don't usually speak to specific circumstances, but this obviously has been in the news, and I'm happy to report that this patient has an appointment with the BC Cancer Agency tomorrow in Kelowna at the Interior Cancer Centre, and BC Cancer Agency has reached out directly to him and his family to ensure that he receives the very best care that he deserves.
Member for New Westminster on a supplemental.
Honourable Speaker, it is true that Fred finally has an appointment with the BC Cancer Agency. But the reality that the minister can speak to and should speak to is that cancer patients in British Columbia are waiting longer and longer for treatment, and it's happening on this minister's watch. The minister says that decisions about priorities are made by doctors. However, we know that before Fred's story aired on TV, the Cancer Agency hadn't even gotten in touch with him. After his story aired on TV, he finally got a call. Again to the Health Minister, why do British Columbians have to rely on headlines in order to get the treatment that they need?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, I think it is not necessarily appropriate to discuss individual cases and symptoms and diagnoses in question period. We rely on physicians, we rely on healthcare professionals to make clinical judgments, to do the necessary tests, to carry out the procedures that are necessary to ensure that people remain healthy. In this instance, Honourable Speaker, the gentleman was seeing his family physician, was referred to a specialist, and now has been referred to the BC Cancer Agency. Honourable Speaker, skin problems, cancer problems, any kind of health problems are not necessarily easy to solve or solvable in question period. We rely on health professionals to make these decisions, and we are ensuring that this particular patient has the health care that he needs to ensure a full recovery.
Member for New Westminster on a further supplemental.
Honourable Speaker, there is a pattern here, and it's a very, very troubling pattern. Michael Goldman of Qualicum Beach waited 20 months for a much-needed colonoscopy. 20 months, this is a cancer patient himself, previously suffered from colon cancer. He got no help until he turned to the opposition and to the media. Jing Wang from Parksville needed a family doctor for a diagnostic test, and she got no help until she wrote to her local paper. Both were at significant risk of cancer, Honourable Speaker. Now we found out that Fred Gosman's cancer was left untreated until his story was picked up by a local TV station. The BC Liberals promised health care for British Columbians when they need it and where they need it. So why are British Columbians forced to go to the media to get the cancer treatment that they need?
Minister of Health.
Thank you, Honourable Speaker. Thank you, Honourable Speaker. It's difficult to sit here and be lectured by the opposition on building hospitals, building healthcare facilities. Because when they were in government, Honourable Speaker, we know what they did. They didn't build a single hospital. It was this government, Honourable Speaker, that had the BC Cancer Agency expand throughout the provinces, 6 centres throughout the province of British Columbia. British Columbia continues to lead the country in the best overall cancer rates in Canada, the lowest lung cancer incident rates, the lowest colorectal cancer incidence rates, and the lowest kidney cancer incident rates. Honourable Speaker, BC Cancer Agency and the province of British Columbia leads the country thanks to the work on this side of the House.
Member for North Coast.
Honourable Speaker, Fred's story doesn't just expose a troubling pattern of British Columbians going to the media to get the help that they need. His story also exposes a big gap in our healthcare system, access to specialists for people from small-town British Columbia. Before Fred was waiting for a call from the Cancer Agency, he was waiting for an appointment with a dermatologist. He waited for 6 months. Does the House Minister think this is good enough?
Minister of Health.
Thank you, Honourable Speaker. Honourable Speaker, we have about 10,000 physicians in the province of British Columbia, and if the NDP government in the 90s had done what we have done and doubled the number of doctors being trained in this province, we'd have 11,000 in British Columbia, Honourable Speaker. So I will not be lectured by members over there about how to run a healthcare system, Honourable Speaker. I will not be lectured by that side of the House that did nothing to increase the number of nurses being trained, number of doctors being trained, the number of hospitals available to the people of British Columbia. It is this government on this side of the House, Honourable Speaker, that has done that since we have been in power.